Welcome to Drona Institute of Ayurvedic Studies, Ayurvijnana series, a series of Ayush-related general knowledge questions. Question number 61. The criterion 9 in the framework for assessment and rating of Ayurveda colleges prepared by QCI NABET in consultation with NCSM corresponds to option A, Community Outreach Program, option B, Curriculum, option C, Quality Assurance System, option D, Research Output and Impact. The correct answer is option A, Community Outreach Program. National Accreditation Board for Education and Training, NABET, is a constituent board of Quality Council of India, and they have prepared the framework for assessment and rating of Ayurveda colleges and data capturing format, and has done the assessment for academic session 2024-25 in consultation with NCSM Mobism and published the rankings. And the framework for assessment and rating of Ayurveda colleges have 11 assessment and rating criteria, which have quality and quantitative parameters. And the criterion 1 corresponds to curriculum, criterion 2 corresponds to practical, hands-on and clinical experience, criterion 3 corresponds to teaching learning environment, which is physical, psychological and occupational, criterion 4 corresponds to student admission, attainment of competence and progression, criterion 5 corresponds to human resource and teaching learning process. Criterion 6 corresponds to assessment policy, which is formative, internal and summative assessment. Criterion 7 corresponds to research output and impact. Criterion 8 corresponds to financial resources, which is recurring and non-recurring expenditures. Criterion 9 corresponds to community outreach programs. Criterion 10 corresponds to quality assurance system, and criterion 11 corresponds to feedback and perception of stakeholders. Question number 62. WHO Collaborating Center in Traditional Medicine, Yoga is option A, All India Institute of Ayurveda, option B, Morarji Desai National Institute of Yoga, option C, Institute for Teaching and Research in Ayurveda, option D, Swami Vivekananda Yoga Anusandhana Samsthana, S. Vyasa University. The correct answer is option B, Morarji Desai National Institute of Yoga. The Morarji Desai National Institute of Yoga, MDNIY, New Delhi, has been designated as WHO Collaborating Center in Traditional Medicine, Yoga from 5th April 2013. And it is designated as WHOCC IND 118. And the objectives of this collaborating center is to work as a yoga resource center for information exchange on yoga at national and international level, and in assisting and working with WHO in developing standards for promoting the rational use of yoga, developing educational and practice materials for advocating evidence-based use of yoga, and conduct of customized training programs about the utility of yoga in health promotion at national and international levels for health professionals and WHO fellows. And the Collaborating Center of Yoga have organized WHO Working Group meeting for producing the benchmarks for training in yoga in New Delhi, India from 26 to 28 February 2019 as a part of the standard procedure for development of WHO technical document, and they have organized capacity building workshop on yogic management of diabetes and hypertension, cancer, bronchial asthma and stroke, and international capacity building workshop as a webinar on yoga for non-communicable diseases. The WHO Collaborating Center in Yoga has published several books, and they are consumer information on proper use of yoga, yoga for children, yoga for adolescents, yoga for women of reproductive age, yoga for geriatric population, and yoga for mental health. Question number 63. Ayush Dietary Advisory for Kuboshan Mukh Bharat was published by Government of India. Option A, Ministry of Education. Option B, Ministry of Ayush. Option C, Ministry of Women and Child Development. Option D, Ministry of Health and Family Welfare. The correct answer is option B, Ministry of Ayush. The Ministry of Ayush has launched a composite nutritional guideline, Ayush Dietary Advisory for Kuboshan Mukh Bharat, to improve nutritional outcomes in children, pregnant women, and lactating mothers with Ayush practices and principles. And the contents are general dietary advisory, specific dietary recommendations for pregnant women, specific dietary recommendation for lactating mother and children, dietary and Ayush advisory for anemia in pregnancy and for malnourished children. And in that book, it is mentioned that there are 5 rights of Ayur portion, and they are right time, right quantity, right quality, right methods, and right place. And Ayush Dietary Advisory for Kuboshan Mukh Bharat was prepared by Program Management Unit at National Institute of Ayurveda, Jaipur, in consultation with the National Consultation Team. And it was prepared by Chairperson Professor Meeta Kotecha, who is the former professor of National Institute of Ayurveda, Jaipur, and Member Secretary Dr. Nisha Oja, who is the Associate Professor at National Institute of Ayurveda, Jaipur. Question number 64. Union government is planning to introduce a new integrated medical course combining MBBS and BAMS at option A, Jawaharlal Institute of Postgraduate Medical Education and Research, JIPMER, Puducherry. Option B, Postgraduate Institute of Medical Education and Research, Chandigarh. Option C, Vardhaman Mahavir Medical College and Safarjung Hospital, New Delhi. Option D, All India Institute of Ayurveda, New Delhi. The correct answer is option A, Jawaharlal Institute of Postgraduate Medical Education and Research, JIPMER, Puducherry. The Union government is planning to introduce a new integrated medical course combining MBBS and BAMS at Jawaharlal Institute of Postgraduate Medical Education and Research, JIPMER, Puducherry. The Union Minister of State for Health and Family Welfare and Ayush, Sri Pratap Rao Jadhav, has announced the launching of integrated medical course at JIPMER after inaugurating the renovated Emergency and Trauma Care Center at JIPMER on 27 May 2025. The integrated medical course is currently at the conceptual stage and efforts are underway to frame a new syllabus. Question number 65. Ayush Holistic Wellness Center at Supreme Court is an initiative of Supreme Court of India in collaboration with Dash under Ministry of Ayush. Option A, Central Council for Research in Ayurvedic Sciences, CCRAS. Option B, Directorate General of Health Services, DGHS. Option C, National Institute of Ayurveda, NIA. Option D, All India Institute of Ayurveda, AIAPGET. The correct answer is option D, All India Institute of Ayurveda. Ayush Holistic Wellness Center at Supreme Court is a collaborative initiative of Supreme Court of India in collaboration with All India Institute of Ayurveda under Ministry of Ayush. The Ayush Holistic Wellness Center in the Supreme Court premises is a state-of-the-art facility providing holistic care addressing physical, mental, and emotional well-being, promoting overall health of the judges and staff of the Supreme Court of India. Former Chief Justice of India, Justice D.Y. Chandrachud, inaugurated Ayush Holistic Wellness Center in the premises of Supreme Court of India on 22nd February 2024. In the august presence of Sri Sarbananda Sonowal, Minister of Ayush and Ports, Shipping and Waterways, and Dr. Munjpara Mahendra Bai, Minister of State for Ayush. An MOU regarding establishing, operationalizing, and providing expert services at Ayush Holistic Wellness Center was also signed between the Supreme Court and the All India Institute of Ayurveda. Question number 66. The first ever Global Summit on Traditional Medicine, organized by WHO and co-hosted by Ministry of Ayush, was organized in option A, Jamnagar, Gujarat. Option B, Jaipur, Rajasthan. Option C, Gandhinagar, Gujarat. Option D, New Delhi, Delhi. The correct answer is option C, Gandhinagar, Gujarat. The first ever Global Summit on Traditional Medicine towards Health and Well-being for All was organized by World Health Organization and co-hosted by Ministry of Ayush, was organized in Gandhinagar, Gujarat on 17 to 18th August 2023. The main outcomes of the Global Summit were released by the World Health Organization in the form of Gujarat Declaration. And Gujarat Declaration reaffirms that global commitments related to indigenous knowledges, biodiversity, and traditional complementary and integrative medicine. Gujarat Declaration emphasized that the importance of traditional medicine is recognized for the attainment of universal health coverage, and World Health Organization's commitment to work toward it through evidence generation and policy support to member states. In the summit, WHO also has shared the initial findings of the Global Survey on Traditional Medicine that indicates that the reach of traditional medicine is on the rise across the globe. This event also saw that health ministers conclave on G20 nations on traditional medicine on the sideline of G20 health ministers meet whereby the G20 nations talked about a role and prospects of traditional medicine in their respective countries. Question number 67. Bureau of Indian Standards had published Indian standards for specification of which among the Ayush products mentioned below? Option A, cotton yoga mat. Option B, Panchakarma equipment Droni. Option C, Panchakarma equipment Shirodhara Yantra. Option D, all the above. The answer is option D, all the above. The Bureau of Indian Standards, BIS, is a national standards body of India, and it is under Department of Consumer Affairs of Ministry of Consumer Affairs, Food and Public Distribution, Government of India. It is established by the Bureau of Indian Standards Act 2016, which came into effect on 12th October 2017 and is headquartered at New Delhi. And BIS is involved in developing national standards on products, processes, and services, which are called as Indian Standards, IS. And Bureau of Indian Standards has created a dedicated department of standardization in the Ayush systems. A new Ayush Division Council has been created under the chairmanship of the Secretary, Ministry of Ayush, Government of India, to guide the work of standardization in the field of Ayush systems in the Ayush Standardization Department in the Bureau of Indian Standards. Ayush products are currently traded in over 150 countries either as medicine or food supplements. And to enhance the safety, quality, and effectiveness of Ayush system, international standards are being established in collaboration with Bureau of Indian Standards through this vertical. And this will help in more acceptance and will open the door of huge exports of Ayurveda products and services in more than 165 countries. And this initiative fosters consumer confidence in Ayush products. And the BIS has published Indian standards in Ayush, and they are Glossary of Ayurveda and Yoga Terminology. The number of Indian standards are 6 in number. Ayurveda and Yoga products and services, there are 4 Indian standards. Indian standards recommending specific requirements of single herbs for their use in traditional medicine. 17 Indian standards has been published. And the Indian standards published by Bureau of Indian Standards in Ayurveda Yoga products and services. The first one is IS 17873 2022, which is titled as Yoga Mat, Cotton Yoga Mat Specification. IS 18089 Part 1 2022, the titled as Panchakarma Equipment Part 1 Droni Specification. IS 18089 Part 2 2022, Panchakarma Equipment Part 2 Shirodhara Yantra Specification. These are the 3 Ayurveda and Yoga products Indian standard published by Bureau of Indian Standards, and IS 17913 2022. It is Yoga Center Service Requirement Indian Standard published by BIS. And there are 2 Indian standards published by BIS which is related with Ayush. The first one is IS 17924 2022. The standard related to the determination of pesticide residue of herbal materials, and IS 17942 2022, which is a standard related to tourism and related services, medical tourism service requirements. Question number 68. The first ISO standard technical report titled ISO/TR 4421 2023 Health Informatics Introduction to Ayurveda Informatics was released by Option A, International Organization for Standardization. Option B, Bureau of Indian Standards. Option C, Directorate General of Health Services. Option D, Central Council for Research in Ayurvedic Sciences. The correct answer is option A, International Organization for Standardization. The International Organization for Standardization, ISO, released the first ISO standard technical report titled ISO/TR 4421 2023 Health Informatics Introduction to Ayurveda Informatics. The technical report aims to provide a foundational understanding of the Ayurvedic medicine system. It introduces numerous aspects and processes that are inherent and necessary in Ayurvedic diagnosis and treatment. An ISO/TC 215 dedicated working group WG10 on traditional medicine was formed in International Organization for Standardization in response to a proposal presented by the Bureau of Indian Standards for standardization in the field of Ayurveda informatics. 3 more Indian applications are currently being considered for the standardization on traditional medicine within the ISO/TC 215 health informatics to produce international deliverables. Question number 69. Ayush Sanjivani mobile app was developed by Government of India. Option A, Ministry of Health and Family Welfare. Option B, Ministry of Ayush. Option C, Ministry of Electronics and Information Technology. Option D, both B and C. The correct answer is option D, both B and C. Ayush Sanjivani mobile app was developed by Ministry of Ayush and Ministry of Electronics and Information Technology. The app was launched by Dr. Harshvardhan, Union Health and Family Welfare Minister, in the presence of Sripad Ashok Naik, Ministry of State for Ayush during May 2020. The Ayush Sanjeevani mobile app was developed to generate data on acceptance and usage of Ayush advocacies and measures among the population and its impact in prevention of COVID-19. And 1.35 crore respondents and analysis of 7.24 lakh public data revealed that 85.1% of the respondents used Ayush measures for the prevention of COVID-19, and among which 89.8% respondents agreed to have benefited from the practice of Ayush advisory measures. Question number 70. Bureau of Indian Standards had published Indian Standards for Glossary of Ayurvedic Terminology for which among the following? Option A, Standardized Terminology for Fundamental Principles. Option B, Standardized Terminology for Foods and Beverages. Option C, Standardized Terminology for Medicinal Preparations. Option D, all the above. The correct answer is option D, all the above. The Bureau of Indian Standards is the national standards body of India, and it is under Department of Consumer Affairs of Ministry of Consumer Affairs, Food and Public Distribution, Government of India. And BIS is involved in developing national standards and products, processes, and services, which are called as Indian standards. And the Bureau of Indian Standards has published Ayush related Indian standards and Glossary of Ayurveda and Yoga Terminology. There are 6 Indian standards. Ayurveda and Yoga Products and Services, there are 4 Indian standards. And there are 17 Indian standards recommending specific requirements of single herbs for their use in traditional medicine. And the Glossary of Ayurveda and Yoga Terminology, there are total 6, and 5 are related with Glossary of Ayurvedic Terminology. Indian Standard IS 17424. Part 1 is related with Standardized Terminology for Fundamental Principles. Part 2 is related with Standardized Terminology for Diagnostics and Etiological Factors. Part 3 is related with Standardized Terminology for Food and Beverages. Part 4 is related with Standardized Terminology for Medicinal Preparations. And Part 5 is related with Standardized Terminology for Body Structure and Function. And Indian Standard IS 17874. Part 1 is related with Yoga Terminology, Glossary of Yoga Terminology, which is standardized terminology for commonly used terms related to yoga. And the Indian Standard related with Ayurveda and Yoga Products and Services. Cotton Yoga Mat IS 1787322. Panchakarma Equipment Part 1 Drona Specification Indian Standard IS 18089 Part 1 2022. Panchakarma Equipment Part 2 Shirodhara Yandra Specification Indian Standard IS 18089 Part 2 2022. And these are Ayurveda and Yoga Products, and one Yoga Center Service Requirement Indian Standard IS 17913 2022. Question number 71. The subordinate office under Ministry of Ayush, Government of India, for the development of pharmacopoeias and formularies is option A, PCIM&H, option B, CDSCO, option C, CCRAS, option D, AIIA. The correct answer is option A, PCIM&H. The Pharmacopoeia Commission for Indian Medicine and Homeopathy, short-termed as PCIM&H, is a subordinate office under Ministry of Ayush, Government of India, for the development of pharmacopoeias and formularies. It also functions as the central drug testing cum appellate laboratory for ISM and homeopathy system of medicine. The commission was initially established as Pharmacopoeia Commission for Indian Medicine (PCIM) on 18th August 2010 as an autonomous body under Ministry of Ayush. It was registered under Societies Registration Act 1860 on 31st August 2010. Homeopathy was incorporated and commission was renamed as Pharmacopoeia Commission for Indian Medicine and Homeopathy (PCIM&H) on 20th March 2014. The Government of India had set up Ayurveda Pharmacopoeia Committee in 1962, Siddha Pharmacopoeia Committee in 1975, Unani Pharmacopoeia Committee in 1964, and Homeopathic Pharmacopoeia Committee in 1962. The four Pharmacopoeia committees having their secretariat at respective research councils under Ministry of Ayush were brought under the auspice of PCIM and H. Moreover, two central laboratories were established as subordinate office under Ministry of Health and Family Welfare, namely Pharmacopoeia Laboratory for Indian Medicine (PLIM), which was established in 1970, and Homeopathic Pharmacopoeia Laboratory (HPL), which was established in 1975. And these two were merged to PCIM and H as per the central government decision dated 3rd June 2020. And the objective of Pharmacopoeia Commission for Indian Medicine and Homeopathy is to develop pharmacopoeia for drugs or formulations of Indian medicine and homeopathy, to develop formularies of Indian medicine, to maintain an authentic reference raw material repository of raw materials used in Indian medicine and homeopathy, and to maintain an authentic reference chemical markers repository of chemicals with established therapeutic significance for drugs or formulations of Indian medicine and homeopathy. Question number 72. Which of the following is not an ingredient of Ayuraksha kit developed by All India Institute of Ayurveda to boost immunity to fight against COVID-19? Option A, I-64. Option B, Chavanaprash. Option C, Samshamanavadi. Option D, Anutaila. The correct answer is option A, I-64. Ayuraksha kit was developed by All India Institute of Ayurveda with the support of Ministry of Ayush, and it is a set of Ayurvedic medicines specially prepared to boost the immunity to fight COVID-19. And the ingredients of Ayuraksha kit are Chavanaprash, Ayush Quad, Samshamani Vadi, and Anutaila. The Ayuraksha kit was listed by Jan Aushadhi Kendra and the Pradhana Mantri Jan Aushadhi Pariyojana. And the dosage of the ingredients in Ayuraksha kit are Chavanaprash 6 gram once a day, Ayush Quad 75 ml. 3 gram powder boiled in 150 ml water and reduced to 75 ml, which should be used once a day. Samshamani Vadi 500 mg twice a day. Anutaila 1 to 2 drops nasal application in each nostril with fingertip once a day. And the usage is for 30 days. Question number 73. Memorandum of Understanding was signed between PCIM and H and Dash for interministerial cooperation for the promotion of one herb, one standard. Option A, National Medicinal Plants Board. Option B, National Biodiversity Authority. Option C, Indian Council of Agricultural Research. Option D, Indian Pharmacopoeia Commission. The correct answer is option D, Indian Pharmacopoeia Commission. Memorandum of Understanding was signed between Pharmacopoeia Commission for Indian Medicine and Homeopathy under Ministry of Ayush and Indian Pharmacopoeia Commission under Ministry of Health and Family Welfare in New Delhi for interministerial cooperation for promotion of one herb, one standard. Different standards and different analytical methods are published in Ayurveda, Siddha, Unani and Homeopathy pharmacopoeias compared to Indian pharmacopoeia. Ministry of Ayush desires to remove this ambiguity through one herb, one standard initiative. Through this MOU, each monograph will have Indian standards along with the international quality requirements. All Indian quality standards become contemporary with the global standards for the same botanicals. And the primary objective of the MOU is the development of cooperative efforts between PCIM and H and IPC, Indian Pharmacopoeia Commission, to promote public health by facilitating the development of harmonized herbal drug standards. And according to Ministry of Ayush, harmonization of standards will fulfill objective of one herb, one standard and one nation, improve ease of doing business in India, improve overall trade of Indian botanicals, and prove a significant step towards Atmanirbhar Bharat. Question number 74. Ayurvedic Pharmacopoeia of India, API, Part 1, Volume 10, containing minerals and metals, is published in the year. Option A, 2019. Option B, 2022. Option C, 2025. Option D, 2015. The correct answer is option B, 2022. API is Ayurvedic Pharmacopoeia of India, and it was published by Pharmacopoeia Commission for Indian Medicine and Homeopathy, PCIM and H. The Pharmacopoeia Commission for Indian Medicine and Homeopathy is a subordinate office under Ministry of Ayush, Government of India, for the development of pharmacopoeia and formularies. And Ayurveda Pharmacopoeia of India has two parts, Part 1 and Part 2. Part 1 contains single drugs and Part 2 contains formulations. And Part 1 has 10 volumes having detailing of 665 drugs as monographs, and part 2 has 4 volumes having detailing of 202 formulations. And this is Ayurveda Pharmacopoeia of India, part 1, consisting of single drugs. Volume 1, year of publication is 1986. Number of drugs as monographs 80. Volume 2, 1999. Number of monographs 78. Volume 3, 2001. Number of monographs 100. Volume 4, 2004. Number is 68. And volume 5, 2006. The number of monograph is 92. And volume 6, year of publication is 2008. Number of drugs as monographs 101. Volume 7 is basically related with minerals and metals, published in 2008, and number is 21. Volume 8 is hydro, alcoholic and water extracts of drugs, published in 2011, and there are 60 monographs. Volume 9 also contain hydroalcoholic and water extracts, published in 2016, having 45 monographs, and volume 10, which is a question, having minerals and metals, published in 2022, having 20 monographs. And total there is 665 drugs mentioned in Ayurvedic Pharmacopoeia of India, part 1. Part 2 consists of formulations. There are 4 volumes. Volume 1, by year of publication, is 2007. And there are 50 formulations published in this. Volume 2 in 2008, 51 number. Volume 3 in 2010, there are 51 formulations. Volume 4, 2017, and there are 50 formulations, and total 202 formulations has been published in part 2 of Ayurvedic Pharmacopoeia of India. Question number 75. According to Food Safety and Standards, Ayurveda Ahara Regulations 2022, Ayurveda Ahara is a food prepared in accordance with the recipes or ingredients or processes as per method described in authoritative books of Ayurveda, listed under dash of these regulations. Option A, Schedule A. Option B, Schedule B. Option C, Schedule E1. Option D, Schedule C. The correct answer is Schedule A. Food Safety and Standards Authority of India has formulated Food Safety and Standards Ayurveda Ahara Regulations 2022 in consultation with the Ministry of Ayush and notified the regulations in the official gazette on 5th May 2022. The regulations define Ayurveda Ahara, a food prepared in accordance with the recipes or ingredients or processes as per the method described in the authoritative books of the Ayurveda, listed under Schedule A of these regulations. And the regulations inter alia exclude Ayurvedic drugs or proprietary Ayurvedic medicines and medicinal products, cosmetics, narcotics, or psychotropic substances, herbs listed under Schedule E1 of Drug and Cosmetic Act 1940 and Rules 1945, metal-based Ayurvedic drugs or medicines, basma or pishti, any other ingredients notified by authority from time to time, food items in daily use such as pulses, rice, flour, vegetables, without addition of Ayurveda ingredients. And for ease of identification and assurance about genuineness of the product, all such products shall carry Ayurveda Ahara logo in close proximity to the product, the specified logo in front of the back of the label. And the label shall carry statutory warning only for dietary use. Other labeling requirements have also been specified by FSSI. Question number 76. The color of Ayurveda Ahara logo prescribed by Food Safety and Standards Authority of India, FSSAI, is option A, blue, option B, green, option C, yellow, option D, red. The correct answer is option B, green. And this is the Ayurveda Ahara logo, which is represented in green color. Ayurveda Ahara logo was launched by Union Health Minister Dr. Mansukh Mandavia on the occasion of World Food Safety Day on June 7, 2022. And the logo on food products allow for easy identification and create a unique identity of Ayurveda Ahara. And this measure is also likely to reinforce quality of Ayurvedic products. And according to Food Safety and Standards Ayurveda Ahara regulations from FSSAI, Ayurveda Ahara is a food prepared in accordance with the recipes or ingredients and or processes as per methods described in the authoritative textbooks of Ayurveda, listed under Schedule A of these regulations. And this is the logo of Ayurveda Ahara. The letters A and E combined in such a way that they appear to be a single form. The symbolic 5-leaf represent the 5 elements such as either Agash, air Vayu, fire Agni, water Jala, and earth Prithvi. And it helps the consumer to identify the product as Ayurveda Ahar. The color green or color tone of the logo representing Ayurveda Ahar is natural, biotic, wholesome, herbal, and organic. And according to FSSI, the design of the logo is such a way that it contains initial letters of the words Ayurveda and Ahar in Devanagari and English, mentioned as A and A. And the FSA shall constitute an expert committee under the Ministry of Ayush consisting of relevant experts, including representatives of Food Safety and Standard Authority of India, for providing recommendation on approval of claims and products, and the committee shall also empower to address concerns regarding registration or licensing or certification or laboratory accreditation or testing or quality issues related to Ayurveda Ahar. Question number 77. The college which has secured the first rank with A grade in national level QCI, NABET, and NCISM rating for the academic year 2024-25. Option A, National Institute of Ayurveda, Jaipur. Option B, SDM College of Ayurveda and Hospital, Udupi. Option C, All India Institute of Ayurveda, New Delhi. Option D, Vaidyaratnam PS Warrior Ayurveda College, Kottakkal. The correct answer is option A, National Institute of Ayurveda, Jaipur. The National Accreditation Board for Education and Training, NABET, is a constituent board of Quality Council of India, and they have prepared the framework for assessment and rating of Ayurveda colleges and data capturing format, and has done the assessment for academic session 2024-25 in consultation with NCISM, Marbism, and published the rankings. And they have classified the Ayurveda colleges into 3 grades A, B, and C. And these are the final rankings of 2024-25 with A grade. Rank 1 is awarded to National Institute of Ayurveda, Jaipur, Rajasthan. Rank 2 is SDM College of Ayurveda and Hospital, Udupi, Karnataka. Rank 3 is Vaidyaratnam PS Warrior Ayurveda College, Kottakkal, Kerala. Rank 4, SDM College of Ayurveda and Hospital, Hassan, Karnataka. Rank 5 is Dr. D.Y. Patil College of Ayurveda and Research Institute, Navi Mumbai, Maharashtra. Question number 78. CCRAS and NCSM launched SMART 3, which is a national initiative to promote option A, mental health, option B, maternal health, option C, adolescent health, and option D, geriatric health. The correct answer is option D, geriatric health. SMART is Scope for Mainstreaming Ayurveda Research Among Teaching Professionals, and it is a flagship initiative by Central Council for Research in Ayurvedic Sciences, and it is now in its 3rd phase, which is called as SMART 3. The key objectives is to empower Ayurveda faculty to engage in research, to promote high-quality clinical studies, to focus on age-related healthcare and healthy aging. And CCRAs and NCSM proudly launched SMART 3, and it is a national initiative to promote clinical research in geriatric health. And this is a submission of expression of interest. The last date is 25th June 2025. The eligibility is to NCSM recognized Ayurveda institutions, and those faculty who are working in these institutions can apply. And the call for expression of interest is on geriatric health, and which is a CCRS initiative for Swastha Vruddha Sughi Loga. Question number 79. Which of the following Gugulu preparation and Malahara preparation is included in Ayurvedic Pharmacopoeia of India, API Part 2, Volume 1? Option A, Yogaraja Gugulu and Sarjarasa Malahara. Option B, Kaishora Gugulu and Darvi Malahara. Option C, Simhanada Gugulu and Gandhaka Malahara. Option D, Tribhala Gugulu and Tutta Malahara. The correct answer is option B, Kaishora Gugulu and Darvi Malahara. API is Ayurveda Pharmacopoeia of India, published by Pharmacopoeia Commission for Indian Medicine and Homeopathy. And it has 2 parts, Part 1 and 2. Part 1 contains single drugs and Part 2 contains formulations. And Part 1 has 10 volumes having detailing of 665 drugs as monograph. And Part 2 has 4 volumes having detailing of 202 formulations as monographs. And in Ayurveda Pharmacopoeia of India, Part 2, Volume 1, Gugulu, the only Gugulu mentioned is Kaishora Gugulu. The only Malahara mentioned in Volume 1 is Darvi Malahara. The only Guliga mentioned is Marijadi Guliga. And some specularities are also there in Volume 2. All the Asavas and Aristas are mentioned in Ayurveda Pharmacopoeia of India, Part 2. The Taila mentioned in volume 2 is Shambhugadi Tailya. The only device which is mentioned in volume 2 is Kshara Sutra. And in volume 3, the only Churna which is mentioned is Chitragadi Churna. The only Grida which is mentioned is Sukumara Grida. The only tablet is Punarnava Mandura. And in volume 4, in Vadi and Guliga, Pranada, Guliga and Dugdha Vadi is only mentioned. And in Kwada Kanavadi, Bala Jiragadi Kwada tablets and Nayobayam Kwada tablet is mentioned in Ayurveda Pharmacopoeia of India, Part 2, Volume 4. Question number 80. Ayurveda Wellness Center in the campus of Lal Bahadur Shastri National Academy of Administration, Missouri, was established by option A, Central Council for Research in Ayurvedic Sciences, CCRAS. Option B, Directorate General of Health Services, DGHS. Option C, National Institute of Ayurveda, NIA. Option D, All India Institute of Ayurveda, AIIA. The correct answer is option D, All India Institute of Ayurveda, AIIA. Ayurveda Wellness Center in the campus of Lal Bahadur Shastri National Academy of Administration, Missouri, was established by All India Institute of Ayurveda, New Delhi, under the Ministry of Ayush. The setting up of Ayurveda Wellness Center in the campus of Lal Bahadur Shastri National Academy of Administration, Missouri, is in consonance with the National Health Policy, NHP 2017. The National Health Policy 2017 strongly advocates mainstreaming the potential of Ayush within a pluralistic system of integrative healthcare. And the objective of Ayush Wellness Center is to provide holistic healthcare through Ayurveda and to sensitize and bring awareness about Ayurvedic principles to officer trainees, staff, and their families of the IAS Academy. Thank you.